I will officially call the 10/15/2020 public safety meeting to order. Could we all rise? And Chief, you've got the flag, so do the Pledge of Allegiance, please.
Pledge allegiance to the flag,
to the flag
of the United
of the United States of America, and to the republic
for which it
for which it stands,
one
one
nation,
nation,
under God,
under God,
indivisible,
indivisible,
with liberty
with liberty and justice for all.
Thank you, Chief.
My honor.
Good to see everyone on this beautiful New England morning where we're all gonna freeze our tails off in the morning and then need shorts and a t-shirt in the afternoon. So always fun trying to dress your kids for school, as I'm sure you guys work through all the time. All right, we will quickly do a roll call here. Melissa Appleby.
Good morning.
Hey, good morning. Chief Jim Baldus.
I am here. Good morning.
Morning, Chief. Michael Berry.
Good morning. I'm here.
Morning. Chief Nick Bolter.
Good morning.
Morning. Town Manager Maria Capriola.
Good morning.
Kristen Formanek, Social Services.
Good morning.
Good morning. Jennifer Catanis, Farmington Valley Health. No, Jennifer. Okay. We don't have Kevin Kowalski anymore. God, I can't believe that still. All right. Mark Kritz. Mark. The Honorable Mike Long. Mike. Melissa Marquis. Mark Massaro.
Good morning.
Hey, good morning, Mark. Sarah Nielsen. I see Sarah.
Good morning.
Morning. Chris Peterson, Board of Selectmen.
Morning, folks.
Hello. Tom Roy, Public Works. Hey, Tom. Nancy Sheets. Karin Stewart. Good friend. Morning. Good morning, Karin. Neil Sullivan.
Yeah, good morning, everybody.
Morning, Neil. Good to see you. And Gary Wilcox.
Gary will not be joining us today, unfortunately.
Oh, that's okay. All right. Thanks, Chief. All right. We'll jump right into the agenda for this morning. We do have public audience. Do we have public audience? No public audience. All right. Continuing the streak of you guys are doing an outstanding job, and the public wants us to keep doing that. So that's how I take the lack of comment. All right. Approval of the minutes from our prior meeting, the 17th. Those were included in our packet. Karin, thank you for a wonderful job as always. Any questions, concerns, updates, changes? All right. Those minutes will stand. And Maria, we don't have anybody from the health district, but do we want to go through the Halloween public health guidance real quick?
Yeah, I think that would be really important. I'm just double checking. I don't see Melissa Marquis or Jennifer. Yeah, do you want to start off with Halloween, Sean, and then I can add anything that might be helpful?
Sure. So we've got some updated guidance from the health district recently that folks probably should have seen going out. I don't have it in front of me. But essentially, the health district, on advice from their counterparts, the state, et cetera, has advised that while Halloween is still on, that we discourage our little ones from the traditional door-to-door festivities in terms of ringing the doorbell, walking up and interacting with folks, right? I believe very much okay to do some smart alternatives to it, whether it be small groups that we have with our closed circles, taking little ones to families' houses or close friends, perhaps leaving candy out. But again, the whole concept of folks crossing paths and interacting with each other is something we're trying to avoid. The town event that we have coming up this weekend on Sunday, right, Maria? Or excuse me, the chamber event.
That's correct.
Is another alternative for the little ones to get out there. So Halloween is not canceled by the Grinch deputy here, but as it's being said in my house. But we are obviously trying to prioritize making sure that all of your little ones out there are staying safe, and we're not turning the wonderful holiday into an opportunity to spread COVID potentially. So Maria, anything else from that side? And I get it.
That was a great overview. I would just add in regards to the town/chamber/performing arts center event this Sunday, that if folks do want to participate, that pre-registration is required due to COVID. And you can go to the Parks and Recreation website to sign up and register there. I believe the cost is $20 per vehicle, so very affordable. Definitely would encourage folks to take advantage of that. And Sean did a really nice summary of some of the low-risk activities that the CDC, the state health department, as well as our local health district are encouraging. So folks are interested in learning more about what would be considered a low-risk Halloween activity. You can go to the town's main webpage, and under the news and announcements section, there's a link on Halloween. So you can go click on that and see, again, some more opportunities that are available.
And just to be clear, there is no enforcement provision tied with this. This is recommendation that the town manager, myself, and the first selectman have agreed with the recommendation and forwarded the message on. But folks should continue to make their own intelligent decisions with their family as they see comfortable. So with that, any questions? All right. Once again, please tell my wife and daughter that I'm not the Grinch that took away Halloween. All right, town manager's office. Maria, additional updates from you.
Good morning. Yes, thank you. A few before I jump into our coronavirus update. We had our debrief, our storm ESIAS debrief with Eversource a couple of weeks back. I'll probably save that for when we get to Mark and we can chat a little bit more about that, but was really thankful for that opportunity and always appreciate Mark and his efforts. We will most likely be putting out some information later this week or early next. Some of the public water utility companies in town will most likely be seeking some voluntary water conservation measures, largely around irrigation. Particularly at this time of the year. So we are gathering some information from them at this time, and we'll be sharing that again, probably later this week or early next. In regards to our virus response, we were really happy to welcome back walk-in visitors to Town Hall and the library last week. At this point of the phase of reopening, we are doing limited hours and limited uses of the building. But again, we're happy to welcome back folks in person. So Town Hall is doing walk-in visitors Monday, Wednesday, Friday mornings from 8:30 to noon. We are reserving the first hour from 8:30 to 9:30 for our senior residents. And the library is doing Tuesday, Thursdays, and Saturdays. So again, we had a pretty smooth reopening for the walk-in visitors at both locations, and we're really happy with how that went. I'd really like to give a public thank you to our facilities team. They have just been absolutely amazing during this. They have really just stepped up the intensity of their cleaning and vigilance, as well as just the physical preparations to get our buildings ready for the public. Really appreciate the really good work they've been doing. We have most of our other town facilities have been opened, again, with either modified services or functioning almost as normal. So most of our, again, parks and recreation amenities, the transfer station, et cetera. We are still doing curbside pickup for library materials on the days that we are not open to the public, and that has been a very popular service, so that is still available for folks. Our senior center will remain closed until further notice. We have been slowly reintroducing various medical services for seniors, and that's been going well. So I'll ask Kristen to elaborate on that a little bit later at our meeting. We're continuing to update the travel advisory information weekly and really trying to help push that information out into the community. So we've been doing that through social media and our website. The no cash payments for the town has been extended through January 1st. I do want to remind folks that we are still accepting payments by check, by credit card, and debit card, and we also have a drop box in front of Town Hall. We are continuing to process a large volume of absentee ballots. We are expecting to process in excess of 10,000 absentee ballots, and in a normal presidential election, it's more around 1,500 to 1,800 ballots. So the town clerk's office has remained incredibly busy, as you can imagine. We do have a secure ballot box in front of Town Hall that is checked daily. You can leave your applications as well as your actual ballots there. And I did just want to alert folks that the week of the election, we do have some days that week that town hall will be closed to the public and town hall staff will be working remotely. This will be the hub for the election, and with a large volume of absentee ballots, we're just going to have, again, a much larger than normal amount of people working in the building, needing to come in and out of the building. So just to ensure that that process is able to do what it needs to do, town hall staff will be scarce in the building for several days that week, and we'll be putting an announcement out in a few weeks about that. And just wanted to follow up quickly on the topic of flu shots. I know I circulated an email, but that I would take an opportunity during the meeting to share some statistics. I think it was Chris Peterson asked a great question at our last meeting around flu shots and statistics for our employees and how many folks have been getting flu shots. And over the last 12-month period, 78% of the covered lives in our health insurance pool, and that includes both the town and Board of Education, folks received a flu shot. And so when we say a covered life, that could be an employee, it could be their spouse, it could be their child, it's anybody who's on their health insurance plan. So again, that was 78% of our covered lives in the pool have received a flu shot in the last 12 months. That translated to 1,394 flu shots. And we did also recently sponsor some employer-sponsored flu clinics on site at our various work locations. And we had 159 Board of Ed folks participate in that, 73 town employees, and 22 of our dependents. So those I thought were some pretty impressive statistics, and want to keep encouraging folks to get your flu shots. And we've also been trying to do our best to assist the VNA and the health district in promoting flu clinics that they're offering. And that's what I have for today.
All right, thank you, Maria. Appreciate
Thank you.
that. Any questions for the town manager? All right, we will jump right into emergency management. Mike Berry.
Good morning, everybody. Just a couple things. Luckily, we've been fairly quiet on our end, as opposed to the last couple meetings in the last couple months. The first item was the drive-through flu clinic we held last week, which was a rousing success. Thanks to all the agencies that participated and helped out to make it a success. We were able to distribute around 200 shots to people. There was no traffic tie-ups. There was no bottlenecks. Everything went very smoothly in the drive-through. And this was a good practice if we ever have to do a mass distribution of vaccinations, so that it proved that not only did it work for the flu clinic for people that registered and wanted it, but it's also going to be something that'll work in the future if we ever have to inoculate many people at a time. Town Manager Maria alluded to our follow-up that we did with Tropical Storm Isaias. We're continuing to revamp our procedures and a couple things that we're going to be doing behind the scenes to make sure that things go smoother for us. Not that it didn't go smooth, but just make it just a process just to make it go a little bit smoother next time. We continue to put out incident action plans weekly for COVID-19, and we're keeping in touch with everybody, including the Farmington Valley Health District, on all that information, and we're getting it out to everybody so everybody knows what's going on at any time. WSIM, the radio station, 103.5. Everybody listen to 103.5. We're putting out information in conjunction with the Senior Center and the Social Services. We're putting out information on the food bank. With the police department. About the vehicles. Yearly D grant was submitted, so we can wow, did I lose everybody there? Okay.
I think we did, yeah.
All right.
Heard you a little bit before the grant.
Okay. All right, a little bit before the grant. So did you get the information on the grant?
No.
Okay. All right. We submitted our yearly emergency management grant to get reimbursement for the town. Emergency management is also taking web EOC classes on a weekly basis to learn how to use web EOC better. And since we have a small group that takes those classes, we're pushing information back and forth so that the people that are putting the system together are getting information on what the towns need. So we're working very well on those classes every Friday. We will be holding a shelter annex meeting from the emergency operations plan to modify it and update it with our limited staff and reduced staff that we have to make sure that everybody knows what's going on should we have to open up a shelter. And especially now that we have COVID, we're going to be adding in the COVID restrictions that we have to go along with that. McLean Home has invited us to do a tabletop drill next week, and the invitation went out this morning to the other part of the Unified Command if they want to join in with it. It's a yearly event that we do, and it's very good to have communication back and forth with them. And also, WSIM will be participating with the Simsbury Volunteer Fire Company Road Rally. And along with that, we're going to have a live DJ all day broadcasting the road rally, and we will make sure that we push out the Halloween safety information that Maria was talking about, make sure we get that information out. So with that, emergency management is good.
All right, do we want to do the debrief now, or are we going to wait till later in the agenda? We have it as item A under emergency management.
Hey, whatever your
Debrief
preference,
on
Sean.
tropical storm. Is that the tropical storm?
Yeah. Yeah, do you want to just jump right into that, Mike?
Okay.
Maria,
Does
I'm looking
Mark
at the-
want
I want to make sure.
to jump in and start from his side, and then we can dovetail into that?
Sure. So we had a follow-up
Hey,
meeting.
Sean, it's Chris. I don't know if Mike's. I mean, this is a pretty serious topic. I don't know if it's Mike's connection. If we're going to do this now or do it when I prefer Mike reestablish his phone contact into the call, so we can make sure it's all clear from his end.
Yep. Yeah, Mike, you keep cutting in and out robotically, so just want to make sure your connection is good. All right, go ahead, Mark. Sorry about that.
So we had a follow-up meeting with the town and with several members that are on this call, including the first selectman, who's not part of this call, to talk about items that were extremely important to the town for us as Eversource for improvement. Much of it, and correct me if I'm wrong, much of it surrounded around communication, where you needed clear, concise, and very usable information to help plan the town and also getting the roads open in town. Restoration comes as part of that process, but if emergency personnel and business and residents can't move around safely, that is basically the number one priority, and restoration will follow. We heard that loud and clear. We have several after action items that we're hearing from all of our communities, not just from Simsbury, but from all the communities that we work with, 149 towns in the state of Connecticut. Very similar concerns, very similar needs. Obviously, every town has very different structure, but we heard loud and clear from Michael, from Tom, from Maria, from both chiefs of the police and fire, that improvements need to be made, and we have multiple things that we're going to be working on to follow up on. But we're also going to be introducing a few new portals and tools that should help us get more information to you, more accurate information on a more real-time basis going forward. So that's just really a quick synopsis, and as far as I see it. Maria, if you want to add to that, please.
Yeah, Mark, thank you. Again, I really want to emphasize we're always so grateful to Mark. He's just been such a good partner for us. And we also were really grateful to the folks, I call them sort of the boots on the ground during the storm. So those were the linemen, the Make Safe crews. They just worked incredibly hard. And so really, really pleased with that work. And, as Mark had said, where we were probably most frustrated in particular was how long it took to do the Make Safe work in our neighborhoods. And that's where we really refer to neighborhoods that are truly cut off, meaning that the folks in the neighborhood can't pass in and out of their neighborhood safely. It's difficult to get emergency vehicles into those neighborhoods in the event somebody has, for example, a call and needs an ambulance or a fire truck. We had instances of wires that we found that were downed and energized for days. There was an instance where there was a guardrail that had been energized by a down wire. And we just were really, again, quite frustrated with the length of time that had taken to make safe, not restoration, but to make safe. And so we had communicated that to the folks at Eversource and would like to see that as a priority in the future. We also talked quite a bit with them about coordination, that, once a Make Safe person was in fact in town and connected with our public works crew, they just worked so well together and we were able to really tackle items relatively quickly. But one of the challenges we had was working with the person who was assigned to us for the purpose of the storm. That person was not Mark, but the person from Eversource who was our liaison, and just getting good information in terms of when we could expect a crew, where they would be, connecting them up to our public works crew. So we had resources mobilized and ready to go, and we were just waiting and didn't have good information in terms of when to expect, again, those crews, and again, just the ability to connect those crews to our team. So those were some of, I would say, the biggest challenges that we found during the storm, and definitely, I think, relayed those concerns to Eversource, and definitely, I think, felt that some of those concerns were being heard. Mike, Tom, both chiefs, anything?
Maria, can I just jump in one second? And Sean and Chris, you obviously you weren't part of the call, but one of the things that I want you to be aware of as well is that we're working on, we've already implemented one additional portion of our storm response team globally. So we've added a group that is solely focused on the block roads, a director and his staff that is part of our response organization. So our troubleshooter organization will be working solely on keeping track of the block roads, getting them assigned and getting them cleared, while the remainder of our operations team will be working on outage related items. So that was implemented, and fortunately Simsbury and many of the surrounding towns in the last couple of larger windstorms weren't dramatically affected. So we didn't really have to roll it out here, but we've had some good success with it. We had that larger windstorm last week where the Granbys and towns along the northern border were affected and implemented that system. And, within the evening or early hours of the next day, almost all of their block roads were cleared up. So it is working. But when we get into, larger scale events, we'll see hopefully the true impact of that group being added as a separate portion of our response team. So really the focus on those items that, Simsbury and many of our towns really were talking to us about. So I just wanted to kind of add that to that as well.
And I appreciate that, Mark. And I think that sounds like an important improvement. One thing I would go back, and you're right, I wasn't part of the call, and forgive me if this is redundant, but communication was a big piece of it. But candidly, from a perception standpoint, there just weren't enough crews soon enough, right, for the scale of the event. So I presume that part of your after action is also looking at how to ramp up, call in extra resources ahead of time, and make sure that we're taking events as seriously as we can. And not that Eversource didn't, but I think this one caught everybody a little bit by surprise with the scale of damage, so that I'd rather see us over prepare and send folks home versus under prepare and have energized guardrails in the future, right?
Yeah, understood. And that's a lot of our after action plans that are being developed, internally and with our regulators.
Yep.
A lot of that is going to be discussed as we move forward. So
yeah, I figured. I echo everything everyone says. You've been a phenomenal partner. Not a knock on the boots on the ground. All the folks. I mean, right down 2 houses down was a massive oak on wires. And again, once your crews come in and our guys are there, it's the most beautiful thing. It happens like that. Right. The coordination is outstanding. So really do appreciate that. But I'll step back. Mike, you were going to say something?
No, I was just going to add in that I was going to be working with Mark in the future on their forms that they require. A lot of the forms that they requested were forms that we have not been educated on. So it was a learn on the fly that once we got the forms, we did fill them out properly, but there was a question of how it was being entered on the Eversource side. So Mark and I are going to be working on that going forward. I think we have great communication right now between us. I think we definitely put out our concerns about the storm, what we felt, what we were going through, and Eversource is listening. Hopefully, this is going to be something that we can look forward to in the future to work smoother. That's, from my side.
Thank you, Michael. Yeah, and in addition to those forms, we're working on an additional tool that will help, Michael and fire and police with a field portal where a smartphone or a tablet will be able to be utilized in the field and be able to report items, which many of them kind of go in through dispatch. That tool will probably be coming either very late this year. Obviously, we only have about 2 months left in the year, or into the first quarter. We're working through development and testing of that. We don't want to roll it out and then have it fail. So there's quite a bit of things going on in that regard, in that development and in testing, that should give towns that we work with an additional resource and a funnel to feed information in and get feedback directly as well. So there will be additional information. Not that we're taking the liaison out of the loop, but we're kind of having that information go right to our outage management system and have feedback back to those in the towns that, it's extremely important to have. Everyone from our side and from the town should benefit from that and having that information available. We're also implementing a temporary web tool for town dispatch use, and we'll be rolling out some training on that in the next few weeks as an interim step before that larger scale tool comes into effect.
On my end, I would think I would kind of echo what a lot of what's been said, and certainly, Mark, always appreciate you being there and doing what you can to help the town. I always think you're really a great example of how committed you've been to us for well over a decade, I think. And not to harp on it, but the issue with the blocked roads, I just want to make sure that everybody who may be watching this understands. That's when we have a tree down and all of our fire apparatus, all of our police apparatus, all of our ambulances cannot get into those people, and those people can't get out. And what's so dangerous is, and we've seen it during all of these storms, is after a few hours, somebody will go to their shed and get a chainsaw and start cutting that tree, which is entangled in wires. And we had numerous cases of live power lines 2 and 3 days after the storm. And I just, it literally turns my stomach to think how often this happens and how lucky we've been that nobody's been seriously injured. And I think part of that message is also what I saw during this storm is on day 2 and day 3, there were kids out on their bikes riding in and around through these neighborhoods. And I think on our end, we probably need to really highlight during those post-storm events that it's not a time to go for a jog. It's not a time for the kids to go out unsupervised. We had fortunately, it was only a house service down on Firetown Road, and kids literally rode their bike over it, and it was powering the woman's home. So I think we all did really, really well. I'm proud of what our team did, but I think there's always a chance that we can just do a little bit better going forward.
Yeah, I think you're bringing up a great point of public education that we can do during these events. We push a lot of information about restoration and roads, et cetera, but reminding folks, and I know we do, obviously, generator safety and the other basics. And again, how do we do the perimeters? How do we do the blockage? How do we do, I watched some of my neighbors drive right under the police tape that said, don't cross. I didn't. But we became far too callous from the 2010 storm when power was out for so long and there was no power in the town, right? So a lot of folks remember that, and they got really used to doing some pretty poor decision making. So I think an additional education piece is right on, Tom.
Sean, you're right. I mean, getting a little too comfortable with things is the most dangerous situation we could have.
Yep.
So I will work with Michael. I'll try to find even some preparation videos if we have something like that available that you may even be able to use stream, or tied to the town website or to the fire department website that might be useful. I mean, everybody's, tied to watching YouTube and so forth. That might be a good way to share some of that information. So I'll work on my end to try to find what we have that can help with that.
I'd appreciate that. Yeah. Because we have a pretty, I think, high penetration rate between our police website, our Facebook page, fire, Tom Roy, there's a lot of presence from the town departments on Facebook and otherwise, where residents get a lot of bear safety and otherwise. So another avenue I think we can use to help out. All right.
Hey, Sean,
Yeah,
Chris, I'd like to get my I got to get my 2 cents.
You got to get your comment question. Go ahead.
Yeah. Hey, Mark, it's good to talk to you, man. I know we talked on and off. I was not part of that debrief, and I don't suspect that we'll probably have an opportunity to pose these questions. But I do want to, for the public, I do want to share a concern and a question. There's actually a question out of this. My concern is that through all of this, that this actually occurred, because it's not as if Eversource hasn't been operating or been in business for quite some time. I run a business, and it's rare that I launch a new solution to my customers. When I do, there are hiccups in delivery, but for the most part, my core product, which has been around for 40 years, I don't get wrong. I don't know that Eversource has launched a new product in decades, but so it's very concerning to me that we're still putting in place at this point new learning lessons after experience, which these experiences have occurred dozens, if not hundreds of times. So that's my statement of concern. I can't believe we're still learning to this depth when we're talking about such heavy matters. That's my statement. My question is, when Maria's, the respective chiefs, and Tom's concerns were brought back to Eversource leadership, not to you, I understand you don't own the ultimate responses, but when the concerns that we brought back with specific examples of occurrences of time, location, and action or non-action, were the responses from Eversource an acknowledgement that in those individual incidences that Eversource failed, that your current policies and procedures actually failed? Or was there just an excuse given for the reason why we experienced what we experienced? Was there an acknowledgement that, yes, those incidences, your concerns are valid, number one, and number two, we either our current process failed you, or we don't actually have a process in place to respond as it should have?
No,
that's my question to you.
I think our processes are in place, and we follow them. We follow them as they're written. What I feel is that there's 149 towns that were affected by the storm, and in the beginning of the storm we had extra crews in statewide, but the damage was much more extensive than was predicted. So when you ramp up for a storm that you estimate to have maybe 2,000 trouble spots or 5,000 trouble spots, and you end up with twice as many, the volume that you have to deal with in a very short period of time. And this storm rolled through in a very short period of time. It wasn't over a full day where you're able to respond to some things as you go. These things, the resources, and being a Northeast storm, mutual aid resources are thin. We had some mutual aid in, but other areas are not giving up their crews. Other states and other companies are not giving up their resources until their customers have been satisfied. And we saw that the second or third day after the storm concluded, where those resources came. And that's where we saw the uptick in response to the blocked roads and to the outages, where all those, a large complement of crews came to help here. That's where the improvement came. But in the beginning, as in any event, if you have, say in the fire service, you have an event that you have to call on from mutual aid, if they're not available, you're going to do the best you can with what you have until those resources come. And that's what happened here. So I don't think that that our process has failed. I think we could have dramatically improved communication. I'm not going to make an excuse there. We should have been giving you more information to plan and to understand where we stood. But in the response and in having the lack of crews, I don't agree with that.
Yeah, and I
Okay, so if I sum that up, then if this storm occurs again, we're
Yeah.
going to have the same level of response or in devastation. We're going to have better communication. That's the response. We're going to be out for as long as we are and suffer these hot spots. If that's the answer, that's the answer. But we're not going to actually improve the experience. So the response time, the result is not going to be any difference.
I'm not saying that. It depends on the fluidity of, the accuracy of a forecast. We had a forecast that we followed. The information was not as good as we would hope it was going to be. We experienced more damage. We had more tree damage. The model that we use with UConn has been good, but it wasn't as good as we needed it to be in this case. So we had, we plan for what we're forecasting for. And if that is off, dramatically off, then we experience more damage, and that's kind of where we are. But again, working to improve that communication, working to improve the models, and having the ability to bring in crews from other areas. If this was a Connecticut only storm, it would have been a different story. But we had to bring in crews from Canada that have to go through customs during COVID, which has its own, issues to deal with. So there was many things that could have gone better, absolutely. But we're working on addressing those, looking back, looking forward with what we had in the past. So, Chris, I understand your frustration. I've been hearing it from the 13 communities that I work with. And we're working to implement improvements as we go forward.
And if I could jump in here, guys, I hear you both, and I agree with you both. And again, I think, Mark, to summarize quickly, this was a substantial event, whether we knew it was going to be substantial or not. Eversource does not staff enough line crews, nor should they, for this type of event because of the infrequency of it. It would be cost prohibitive to your company, to the ratepayers, to all of us to staff crews to respond to these events. The challenge is, as you said, mutual aid and the size of the area, et cetera. The storm shifted in the last few hours, right? We were supposed to get, a foot of rain, 2 feet of rain, and we ended up getting a lot of wind again. I don't think anybody on this call knew that.
Right.
And it's much like the insurance industry. It's hard to predict, and I get that. We always learn and do better modeling. But I think Chris's point is fair, and I think we need to set the expectations of restoration is probably not going to change dramatically for these type of events that are at this scale. And I don't think anybody on this call is necessarily focused on restoration on the front end. It's really the make safe side. And I think what I heard from you is that through improved communication and through improved resource allocation, we should see better communication and potentially better make safe in the future for these type of events. Is that fair?
That's fair. And that's the reason why we broke off that response organization to separately address the make safe and block road situation.
Yep.
Broke it off from our standard response group, having two sets of leadership focus solely on their responsibilities. One focusing on restoration, the other focusing on the block road make.
Yep.
Excuse me.
The
block road make safe. So parallel paths trying to accomplish, similar items at the same time. So obviously we're all home. Many of us are working from home, studying from home, so forth, and we understand that. But the safety aspect is just as important as restoring service. So that's why we're implementing that separate portion on our restoration team.
And I would argue from this team's vantage point that make safe is the only priority, but for our highest priority nursing homes and other, emergency facilities. And that I think we have an appreciation that while frustrating for our residents, and we don't want to see it go on for days and days and weeks unnecessarily, if we can get to a better level of not having kids ride over power lines 2 or 3 days afterwards, I think that's what we're all trying to get to here. It sounds like that's what you're working towards. So, and I know there's a lot of regulatory environment and a lot of bureaucracy and everything else, but you talked a lot about the improvements. Are we talking about updates in another couple of months, or are we talking about we're not going to see it till next storm? How's the communication for the improvements coming?
That team is already in place.
Yep.
And we've utilized them in the, as I said, Simsbury didn't have much of an effect. We had some outages in town.
Yep.
I spoke with Michael about it, but we didn't have much of an effect of a tremendous amount of damage in that storm last week.
Yep.
I can't say as much for some of the towns north of Simsbury and along that Massachusetts border. They had quite a bit of damage, but that team and the way that we responded to it was a pretty, at least in my eyes and our eyes, that it worked the way it was supposed to work.
Okay.
The towns got the make safe crews. We had other crews doing restoration, and they worked in parallel to really minimize the time that it took to get that done.
Okay.
The technology improvements, we have several things that have been put in place since Isaias, and we're able to see items in real time. So either myself, I should say near real time, say in 15-minute, maybe a 15-minute delay in information. Excuse me. But those items are now available and will be available to our liaisons to see where we are and what's currently happening in our system.
Okay.
The added tools that the town will be able to use will be in the near future. So again, we don't, as Chris alluded to, we don't want to use a tool that hasn't been tested and hasn't been kind of really fleshed out to be an accurate and useful tool.
Yep.
We don't want to put something out there and go backward.
Nope.
So that will be, as I said, hopefully later this year or into the first quarter of next year. They've sped up that timeline, and as soon as I have more information about that, I'll share that with this group, and I'll let you know when we'll start doing testing.
All right, Mark, I appreciate that, and again, I do reiterate, none of this is directed at you. We do, as everyone has said, we do appreciate your partnership, and that you're kind of stuck in the middle here between obviously the utility and a bunch of impassioned folks that just want to make sure that folks are safe. And I know you're part of that team to make sure this community is safe. So we do appreciate that.
Thank you.
All right, we will move on. Jennifer, you are with us. We skipped your place, but we're welcome to go back and have a health district update if you'd like. And we did cover at a high level, although not nearly as well as you would have, the Halloween update.
Okay, good. Sorry, I was a little bit late. So I have some unfortunate news. As you know, across the state, our COVID numbers are continuing to increase, and we are slowly starting to see that play out across the Farmington Valley. Week ending October 10th, we had 43 community cases, which was up from an average of about 20 the 2 weeks prior, so almost a doubling. What we do know about these cases are that some are related to healthcare workers. As you guys are probably all aware, we're dealing with an outbreak in 2 long-term care assisted living facilities in Avon. Other of these numbers are associated with family clusters. So an individual in a household isolated, family members subsequently become ill and test positive as well. So we're keeping a close eye on those numbers across the Farmington Valley Health District. I want to remind everyone, and anything we can do across all of our circles to people are getting COVID fatigue. We understand that. But a lot of the community cases that we're seeing other than healthcare workers are associated with small family gatherings, community, neighborhood parties, et cetera. And we really need to slow down and be reminded that COVID is continuing to circulate in our communities, and we let down our guard. This is how this disease is going to spread. I also want to emphasize this for our workplaces as well. I have observed and heard rumor of situations in which some of our critical infrastructure, police, fire across the district, without calling out specific towns, are determining that workforce does not need to wear masks or socially distance in the workplace environment. The last thing we need is to wipe out any of our critical infrastructure because our workers are not wearing masks or socially distancing in the office setting. So again, please, if you work in that arena, please reinforce the value and the importance of this. The last thing we need is, an outbreak in any one of these settings. I want to, we are working exceedingly closely with all of our school districts. We're following the metrics and developing those metrics for the Farmington Valley every week and releasing those. I can tell you that the schools are doing incredibly well. We have had to isolate and quarantine very small segments of the school population on occasion across the district. In all of these situations, we have had absolutely no secondary transmission in these environments, which is exactly why we do contact tracing and isolate sick individuals and quarantine people that have been exposed. So that is working very, very well. And even though community transmission continues to tick up, we will work very closely with the schools to make any determination about need to adjust scheduling, et cetera. But most are in full time and things are going well there. We know we've moved into phase 3 of the governor's reopening. We will track and monitor that. As you know, or may know, while capacity in things like restaurants increases, it does not eliminate the requirement for the ongoing social distancing and mask wearing. So my expectation is that we probably won't see too much change in that regard, particularly as it relates to places like restaurants. I'll end on, a really positive note and a big, huge thank you to our Simsbury partners. October 7th, we had an exceedingly successful drive-through flu clinic. Nancy and the VNA were a huge part of getting over 200 or approximately 200 flu shots into people's arms in a socially distanced and safe way. As you can imagine, there's a lot of moving parts to a drive-through flu clinic. There were a lot of safety-related issues. Mike Berry and the Simsbury Fire Department out of Weetag were really instrumental in making sure that there was good traffic flow, that we had appropriate signage, and we were supported by law enforcement as well. So we've done it twice now. We know that we can do it. We know what the site needs to look like. I think we can pick this up and take it just about anywhere that, can support cars flowing through. And this just puts us one step further to being able to do this on a large scale, should we need to do that in the future when we have COVID vaccine. One last thing, we are, as part of the Capital Region Council of Governments, taking inventory of our critical infrastructure and essential workforce as we lean forward and prepare for vaccinating, when vaccine becomes available and however essential workforce is defined by the federal government. So moving forward on that. So big thanks to everybody.
Thank you, Jennifer. Appreciate the update. Troubled by the front end there, but I know that our team here is continuing to remain vigilant and keeping our workers and our staff safe. So, and I got my flu shot on Monday. So I am part of that. I was the last one in my household to do it, but we are vaccinated here at 14 David Drive. So,
hey, Sean, it's Chris. But I just want to mention to the team that the Peterson family went through the drive-through, and my wife could not have been more accomplished. I was unable to. Like I had already gotten my wife could not be more complimentary of the experience. So
excellent.
Great.
Sean,
thank you for that.
Yep.
Sean, it's Sarah. Just a quick question. Has there been any talk about doing a drive-through clinic for the children? As many of you know, state law has changed. So where before a lot of us with younger kids under 9 were able to get flu shots at minute clinics and other places, this year we're unable to. And I just want to make sure that we're also concentrating on the kids. Because now, for example, I have to pull my kid out of school to get a flu shot, and I'm sure other parents do as well for the pediatrician's office. Is there any thought about doing a drive-through clinic for just the children?
I know we've talked to some pediatric practices that are actually going to be doing or have been doing some drive-through or meet in the parking lot type of vaccination programs. We can circle back to some of those larger practices. I know they are very interested in working hard, recognizing the importance of getting everyone vaccinated. We have not talked about doing under 9. Nancy, I don't know if you have any comments with respect to that.
I'd be glad to weigh in. When we went through, every year we get orders from our medical director. And, while I think we probably could vaccinate under 9, generally speaking, the best practice for pediatrics was at a certain age, you needed to be under the care of your own pediatrician. And we are not a specialty practice for young children. So when we have our orders signed, our medical director really wanted us to stay 9 and above, because the belief was that under that really should be with a pediatric specialist. That doesn't mean that if a pediatric specialist wanted to do this or set this up, that if they needed extra nursing staff, especially within one of our communities, we could certainly see clear to trying to help support a program like that, but it would have to be under somebody else's physician orders, and we wouldn't be able to do that. We could offer the manpower, but our practice really isn't under the age of 9.
Seems like it's an interesting time to have created more bureaucracy from the state for when we need vaccination.
Agreed. I just, the change between last year and this year, especially during a pandemic, with all of the different executive orders coming down, getting children access to flu shots, you would think would be a priority.
Right.
Yeah. Plus the fact that when they're in their car seat, it's a whole heck of a lot easier to give them a shot.
Yeah.
versus me having to hold them. All right, we'll have that as a takeaway. Other questions for Jennifer? All right, for the go to the order, we'll keep moving this morning. Chief, update from the police department.
Thank you. Good morning, everyone. Nothing COVID-19 specific. Moving on to the radio system. So we're still waiting on the equipment to arrive. It could be a couple more months before that is here, and we'll hopefully be able to move forward with that as soon as possible. An update on our motor vehicle thefts in town. They have continued. 4 thefts since our last meeting last month, which is to give you some numbers. Year to date this year, 28 motor vehicles stolen from town, left unlocked vehicles with keys or key fobs in them, compared to 12 last year at this same time period. If you recall, I think I said last month that in 2019, we had a huge increase toward the latter part of the calendar year. So I think that's why some of those numbers are off, because last year we ended up with much more than 12. I believe it was around 30. So we're still encouraging people to lock their vehicles, lock their garage doors, because we've had people enter unlocked or opened garage doors, enter unlocked and opened vehicles, and take those vehicles away with the keys or the key fobs. So we have created some PSAs and submitted those to WSIM for broadcast. We are trying to do some regular notices now on social media, although I think everybody who follows our Facebook page is fully aware, but we're going to continue to put those out and do obviously what we can on a patrol level and an investigative level to stop this. Again, we are not the only community that is affected by this. All of Connecticut is, Rhode Island, Massachusetts, and New York. Moving on to another very popular topic, it's our bears. We continue to have sporadic bear activity in addition to what we're sort of used to is the sightings and the trash visits. We have had bears enter chicken coops recently. And then we did have a bear that unfortunately attacked a dog in the 340 Hot Meadow Street area, and that dog did not survive. DEEP is fully aware of these activities, and we're working with them to see what we can do about this. Sean, do you mind if I share the screen for a minute?
Absolutely. It's all yours.
Thank you. Not sure if I can.
You should be able to now.
Okay. Oh, yep. There we go. Okay. So if you have not seen it, this is our latest cruiser. And I will scan over to another or scroll over to another picture and just read something for you quickly. So we put this out on the road a few days ago. Public safety is part of a much larger mission at the Simsbury Police Department. That mission is the overall health and well-being of our entire community. Look for the pink cruiser throughout town during the months of October for Breast Cancer Awareness Month and November for No Shave November to help generate donations to support those affected by cancer. Those are our loved ones, coworkers, friends, and neighbors. Together, let's use the pink cruiser as a reminder of how precious life is. Let's use it as a catalyst to bring us closer and inspire the care and compassion we have for each other. Funds raised will stay local to help cancer patients in Simsbury and will be made available through the Connecticut Cancer Foundation, funding critical everyday living expenses such as rent, utilities, and food, and also go towards cancer research. So let's show our support as a community that cares, Sims Cares. And then there's a link to go to a page that the Connecticut Cancer Foundation put together for us where somebody can donate. And we've had some very generous sponsors to help us with that. The wrapping of the cruiser was done by Signs Plus Print, an East Granby business that's owned by a Simsbury resident, and a very generous donation from them, and then also a very generous donation from Big Y World Class Market. So that is the latest of our cruisers, and we will be participating with the Spooktacular Chamber event this Sunday. So if you have not seen the cruiser yet, it will be there for the entire day.
Excellent. Thank you for that, Chief.
You're welcome.
Appreciate the ongoing effort. And just back to my favorite topic, the car thefts.
Yeah.
So my neighbors down the road actually, they had video of two what appeared to be young men, very well could have been from Simsbury. Don't know where they were from. Get out of a vehicle on right off of Climax here. Walk up to the two cars in the driveway, try them, smile for the camera. They know they're there. They don't care. And get back in the car, and you can see them pull up to the next house. And they literally just go down your street at night and try every vehicle until they get one. So, and I've seen a lot of continued outrage and cluelessness on Facebook. Again, we have 165 miles of roadway to patrol. We do not have the manpower, womanpower in the police force, nor would residents want to pay for that to patrol every ounce of that or put cameras up. There's a very, very simple solution here. Lock your damn cars and stop leaving your keys in them. I can't say it enough. Every year I've been on the Board of Selectmen, dozens of cars are stolen and folks are not getting the message, and enough is enough, folks. So, all right. Thank you, Chief. That's my rant for the morning. We will move on to ambulance.
Yes, good morning.
Good morning.
And it's going to sound like a broken record. I don't have a whole lot to report. Our crews still remain healthy. We still have a good stock of our PPE equipment, although the state is not giving us any more, but that's fine. We're going around, and our local sources or suppliers are helping us maintain the stock of gloves and masks and gowns, which we need to keep our crews safe and to help work with our patients. I do want to underline what Jennifer said earlier, which is not a time to sit back and relax and think we're getting through this, because it's going to get worse, and we need to keep with our masks and gloves and our social distancing, because we have seen a slight uptick in terms of patients being transported to the hospital that have the potential to be a COVID patient. I haven't gotten any official reports back from any of the hospitals that they have been positive, but like Jennifer was saying, there's definitely been an upswing. So other than that, like I said, everybody's staying healthy. We're all just hanging in there and keeping our fingers crossed and hoping we get through this flu season. So
Appreciate that. Thank you, Karen. Chief Baldus, fire.
Good morning. And again, we also are reporting no COVID activities within the fire houses or our membership family. So we're continuing to do our practicing of social distancing, mask wearing, and so forth, and continues to pay off. So, and Jennifer, I couldn't agree more in terms of making sure we reinforce that message to keep everybody safe. I think, as everybody's pretty much aware at this point, we had kind of a tough week with some serious automobile accidents in town. And I just want to, again, thank the efforts of the police and ambulance, as well as our volunteers who responded to that incident for their efforts. These are situations that we, certainly are there to do what we can to make the outcome the best it can be. And sometimes even with those efforts, we still have a loss, and it's very, very difficult. But the efforts that are put forth by the emergency services that responded were second to none. The immediacy of the response was there. We were there literally within minutes. Even the fire apparatus happened to be on the road at the time, doing a normal maintenance engineer's check, as we refer to them. So they were there actually earlier than they typically could have been. And so everything that possibly could have been done to change the outcome certainly was there. And again, these situations are unfortunate. We were also called to Avon this past weekend. Some people may not be aware, to assist Avon with another accident that resulted in a fatality too. So our membership has been kind of affected, certainly by having to go to these unfortunate situations, but they continue to remain strong and diligent. We do provide them with some critical stress debriefing sessions that we actually have here at the firehouse. We invited police and ambulance to join as well, and they in turn invited us to one of their sessions that they had at the police department. So just to assure the public that our members, even though they're volunteers, are still getting the training and the professional support that takes place when some of these tragedies do occur. And again, we also thank the outpouring of support that we get from all of our citizens and the agencies. On a more positive news, we had another lost person recently, and this happened right off of Iron Horse Boulevard, off of Helen's Way. An individual who decided to take a walk with some pets got a little bit disoriented. And again, through the cooperation with the police department and also even with some help from the ambulance, we were able to successfully find the individual and bring her back out without incident. Again, just reminding our residents is if you do start to go into the woods or onto these trails, sometimes you can get a little bit disoriented. Please make sure that you have a fully charged cell phone battery before you start. And that's also very, very helpful, because once we can establish the communication, we can make the recovery process to find you much, much faster and quicker. So just keep that in mind. And also don't wait until it starts to get dark. If you find yourself not sure where you are, reach out to get some support and some help, maybe a little bit earlier, so we're not chasing time. And as you know, the time is getting darker quicker. And so we want to make sure that that's kept in mind as well. October, as the chief pointed out, certainly is Breast Cancer Awareness Month, but it's also a month that we do also focus in on fire prevention. Our theme this year was safety in the kitchen, and especially with a lot of the activity of COVID keeping people indoors, there's certainly been a lot more in regards to cooking activities, and which we certainly encourage. We also want to make sure that people do save fires safe when you're using the kitchen and kitchen activities. In addition to that, this is also the time of year that we encourage our residents to check their smoke detectors and carbon monoxide detectors. This is the time, if you do have battery changing style detectors, this is the time to change those batteries. But when you do, is also a good opportunity to check the date on the detector. If you find that the date on the detector is anywhere from 7 to 10 years, probably a good time to replace it. That's the manufacturer's recommendations to replace those detectors. Definitely no later than 10 years, but certainly at the 7-year to 10-year mark, any point in time, it would be a good opportunity to replace them. And many of the detectors that are available now do come with a 10-year battery. So it's a battery you don't have to change once you activate the alarm system for you, or the detector. It will stay active for the duration of its life, up to 10 years. So which is great. You still want to test them though. The other thing too is we're into the leaf season. This is the time where we're clearing our yards and clearing our leaves and so forth. And a reminder that there is no open burning in Simsbury. You are not permitted to burn leaves. You're not permitted to burn brush. Even if you have a campfire that you have a permit for, when you're using that campfire, please do not burn your leaves or brush in that device as well. It should be just standard wood that you would use for appropriate cooking or appropriate campfire use. So, and finally, I just wanted to thank the Board of Selectmen, thank Maria and all of the people who were involved in the last night's passage of the tax abatement ordinance change, which increased the tax abatement to our volunteers on both the ambulance and fire. A lot of work went into that, and we certainly appreciate the support of the community to get that passed. And thank you.
Happy to do that. Those are some of the easiest votes we make. We appreciate all that your department, that ambulance, and all the great folks we have in town do for us. So those are easy, and I'm glad that the state updated those and we were able to get that in. Also, Chief, correct me if I'm wrong, but despite the recent rain, we do need substantially more rain, and such open or campfires and such are really not encouraged right now, right? Due to the dry nature.
Correct. They're really not. We have to be very diligent and careful. Right now, the fire danger is considered to be moderate at this point because we're in kind of the in-between stages of some rainstorms. We do expect hopefully some more rain tomorrow, which may be helpful. but that's not necessarily to get us out of the woods in terms of the potential drought conditions. I think Maria expressed the fact that there may be some changes coming on that down the road as well.
Yeah, just a good reminder. I like to go out at this time of year and have a little campfire and make some s'mores with the kids, but probably we just need to be extra diligent if we do that, given what's going on. So,
absolutely. Thanks.
All right, sir. Thank you for that, and thank you again to your volunteers, ambulance, and police. I know it was obviously a traumatic week here in a lot of ways for folks, and I'm always humbled and appreciative of the support you guys provide after action to make sure that folks go home safe. Because that's important too, and that often gets forgotten. That the trauma doesn't end when the scene gets shut down. So, all right, Neil, Board of Ed, how the kids doing?
Great. Good morning, everybody. We remain on track with our staggered reopening, of full opening of the school system. As you may or may not know, we've been taking this in 2-week increments. And started for the first 2 weeks in our full hybrid model. And then on September 14th, brought back grades K through 2 fully. On September 28th, grades 3 through 6. So our elementary schools have been back full for about 3 weeks now and doing extraordinarily well. And we were pleased after Columbus Day weekend to bring back Henry James to its full capacity. So they had a little trial by fire on Tuesday with a rainy day where outside use was not able to happen. So they had to make their first day with everybody there, work completely for inside lunch and less opportunity to get outside for classes. And they still had an extremely successful day, and they're having a good week. So our last and greatest challenge will come with Simsbury High School, but we are on track with the recommendation of Farmington Valley Health District to continue our reopening plan. And we are scheduled for Tuesday, October 27th to bring our high school students back. And lots and lots of planning by the high school team, because those challenges are the greatest at the high school level. So also want to thank Jennifer. I know she jumped off the call. The protocols that the Farmington Valley Health District has gotten to schools in terms of really clear guidance about being able to talk not only to parents and families, but also to staff members who may have certain symptoms or may have had a contact with someone who is going for a test or who has been to a state with a travel advisory. It's been tremendous to be able to just have very clear protocols to give people very direct advice about what needs to happen in order to either stay out of school or be able to return to school. And not get into a whole lot of gray area about that. So that's been extraordinarily helpful. As you know, we did have the 2 confirmed cases early in the school year. 1 student, 1 adult, no community spread at all. Those were isolated cases. And we were lucky on that front, but you know, we think it's because we're doing a lot of the right things. And we're now at just about a month without a confirmed case. So knock on wood for that. And everybody continues to be excellent about the protocols. There is a little more activity, as you probably know from seeing the news. The CIAC has approved participation in all sports except football. So you probably do see some activities out on the fields if you're driving by. Very strict protocols being followed on those fronts, and so far being done safely. It's going to beg the question for us. Right now, we have not had a lot of community activity in our schools. Really said we were not going to entertain that for the first couple of months, but as certainly some of the winter activities that take place in our schools, we're going to have to make some decisions about whether any community activities are going to be able to take place. So, and then I'll just do one other non-COVID update, and that's on the relaunch of a program we started last year, actually in cooperation with the Simsbury Police Department, which is something called the Say Something program. It actually comes from the folks at the Sandy Hook Promise down in Newtown, which is a nonprofit dedicated to school safety. And what the Say Something program is a anonymous tip system that allows kids to get adults' information. Certainly, as you say, the Sandy Hook Promise, you think about school violence, but it also has to do with situations involving, potential self-harm or mean bullying behavior, other peer behaviors of concern, and get that information to a trusted adult in a way that is safe, and that in an emergency situation allows quick action. It actually involves, in emergency situations, a partnership with the dispatch at the Simsbury Police Department in conjunction with the school system. We launched this program successfully last year, and as our middle school comes in fully this week, it's really kind of giving kids a refresher and a reminder that it exists. And I think it's a really excellent public safety measure that we implemented last year. And thanks to the grant funding for the Sandy Hook Promise, it's all free, and really was a positive start last year, and want to let the community know that it is relaunching. It's been open. I mean, kids have used it sporadically, but we're putting out the reminder to kids that it's there, and they used it very responsibly last year, and that's what we expect again this year. So I'll stop there and see if anybody has any questions.
Neil, I appreciate that. A lot going on. And I can say firsthand, and I think Maria would probably agree with me, as parents of kindergartners, I've been nothing but impressed with the protocols, the diligence, the communication to the parents, but also making it all very natural, and honestly, no big deal for the kids. And I've seen the kids assimilate to the environment that they're in seamlessly, whereas some of us as adults, it seems to be a big deal, but the kids are just rolling with it. And it's and I attribute that to your administrators and your teachers, the folks on the front end, just still making it fun, still having them play together, still having them do all the important things that they need to do as kids, in addition to learning and reading. So seeing that firsthand, and I think your communication from the Board of Ed side, from Matt, from the superintendent, has been outstanding. So thank you for that. That's really been important. Other questions or comments for Neil? Mr. Roy, Public Works.
Thank you. Couple of quick announcements. First one, as Maria mentioned, our buildings and ground staff's been really busy with disinfecting and cleaning all of the buildings, especially as we begin to open up to the public. We've also been very busy, and I think Kristen will go into some more detail on some of the off-site social services programs where we spent a very cold, rainy Tuesday, really helping out a lot of folks with some food. For our highway department, and I think in some ways Farmington Valley Health touched on it, is we have a large workforce, and we are consistently fighting to make sure that we stay vigilant in our social distancing and our mask wearing. Associated with that is we are developing a number of contingency plans as we go into the winter months, that in the event that we are negatively impacted by COVID, we need to continue to be able to provide our services, including snow removal. So we're working a little bit with the fire district on that. We're working with our surrounding towns and also possibly contractors, again, to make sure we have a plan for whatever comes our way. This Saturday, I think Chief Bolter did a nice job of talking about how some of what we do affects everybody else. We're having our household hazardous waste collection. Great opportunity to safely get rid of all of the chemicals in your home. Even if it's something you don't know what it is in a jar that's been in your basement for a couple of years, bring it on down. There are experts here who are going to make sure that it's disposed of properly. And if you check on our Facebook page, just yesterday we went live with our public service request system for the highway department. So if you have a pothole, damaged curb, heaven forbid in the wintertime you have a mailbox issue, you can actually electronically put in that request so that we can hopefully increase our level of service on that. And I see Mark Massaro is still here, so I did just want to touch on one last thing with the tropical storm and the follow-up. I know during the recovery we got into a lot of individual homes where they had medical needs, and electricity was critical to those medical needs. And I think as we talk about how to do things better, we should look at whether or not there's a way to encourage some of those individual folks to look at generators or other options, because the reality is being without power, if it is truly a medical need, there's always going to be that risk, especially with all the trees that we enjoy here in Simsbury. And again, I think there's an opportunity for partnership between all of the people on this call.
Great point, Tom. Thank you. All right, questions for Tom? Kristen, Social Services, still with us?
Yep, here I
There you
am.
are.
Good morning. Thank
Hey,
you.
good morning.
So I'll try to be brief, but I do have several updates that I'd like to share with you, both from Social Services and Senior Center. Social Services, as you know, we're continuing to really help fight hunger in the community and help to get nutritious food into people's bellies. And that really has forged a larger partnership with Public Works, as you heard. We are finishing our drive-through distributions this past Tuesday. We were outside in the rain, and despite the unfortunate weather, we still served 133 households. And I'm very proud of my team and also very grateful to Public Works for allowing us to make that happen. We also have been continuing our partnership with the Salvation Army, and we've been receiving commodities from them as well. So thank you to them for delivering in the rain. For those who are listening, I want to make everyone aware that starting next month, we're going to be trying a distribution within the building. The food products are likely to be ruined or damaged when we're outside in the bad weather, and it's also a little bit difficult for staff. So we're going to try a new approach, and we're going to be doing a throughput in the lower level of Eno Hall. So if you participate in our program, please be aware and please be on the lookout from us for more information from that. We also are continuing to distribute masks as we are out and about in the community more. We all know that it's imperative to have a mask, and masks should be treated as any other piece of clothing. It should be laundered regularly. So we encourage you to have plenty of hand-sewn masks. We still have many, 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 and if you need some, please do contact us and we will make sure that you get what you need. That's open to the community. That offer is open to businesses. Anybody that needs masks, please let us know. For Social Services, important updates. Renters rebate season is officially over. The application deadline has passed, but if you did not apply, you still can apply for an extension. And COVID-19 can be a reason to get an extension from the state of Connecticut OPM. So if you have not applied, please let us know and we will help you to make sure that you get that application done and that you get your rebate. Energy assistance has started. We know that it's already pretty cold here in Connecticut. It was already mentioned, you know, the mornings are pretty chilly, and a lot of us are probably starting our heat already, especially if you're a senior, if you have a medical condition. So please contact our office to make your appointment for energy assistance. All of our appointments are being done remotely and by mail, so things are quite different this year, but we are encouraged that we can still provide this important service, and we will walk you through this. So please contact us for that. We are also starting our holiday season. It's going to be a pretty quick turnaround this year because Hanukkah is early. Hanukkah is starting on October 8th. So we are putting out the information now and asking for donations. Due to COVID-19 restrictions and precautions, We're not going to be collecting actual gifts this year. We are going to only be collecting gift cards and distributing gift cards. That also helps to streamline the process for us and for our staff. So more information on that is on our Facebook page. And if you are looking to donate or if you would like to receive help this holiday season, please contact us. And with the Senior Center, as was mentioned, we are continuing to remain closed to the public and to walk-ins. We are working in close contact with the Farmington Valley Health District. We're taking a regional approach, and Senior Center directors and coordinators did meet just this past Tuesday, and we're all on the same page. We are providing more services than we were before, as was previously mentioned. We offered one flu clinic last week, and we have one flu clinic for our seniors coming up next week on Tuesday. So if you still need to receive your flu shot and you're a senior, you can sign up on the Farmington Valley Visiting Nurses Association website, or you can call them, or please reach out to us and we can help you to make sure that you get a flu shot. We are also now offering our foot care, which is incredibly important to folks that can't tend to that need on their own. Our slots are full, but we are still making appointments. You just might need to wait a little while to get an appointment. But if you'd like to be seen by our foot care nurse, please contact us. And we are also offering our hearing clinics. So if you'd like to have your hearing checked or see the audiologist, please contact us. And we are continuing to provide our Wednesday lunch service to our seniors. That is now being done by drive-through in the commuter parking lots, but we're continuing to provide that important service even in the winter months. So if anyone has any questions on any of those services or what we are doing in Social Services Senior Center, I'm here for questions, or please check our Facebook page, the website, or get in touch with us and we can help you. Thank you.
Thank you, Kristen. That's a ton of stuff and all very much appreciated to help our community. Thank you for all that.
You're welcome.
Nancy, VNA.
Good morning, everybody. Sorry for being late.
No, you're good.
We are, we're cruising around here. Luckily, we, have had been in touch with facilities that we go in and out of in terms of their current concerns for COVID. We are back to we've always stuck with protocol, but now the protocol has gone back to the very beginning in terms of full PPE, no matter where we go. Luckily, my staff remains healthy. We remain mandated to be tested weekly. So we are still doing that. We did have amazing success at the 2 drive-through clinics. Huge shout out to all of the towns, especially in Simsbury, the fire, the police. The drive-through clinics were amazing. We did calculate for the Farmington Valley Health District's sake the amount of time it took for each participant, because if they could do a time study, it enables them to receive further funding, just to show how effective that was. And from the time that the car drove in to the first checkpoint till the time that the individual was driving out after receiving their flu shot, we had it down to 3 to 4 minutes on average. And that's pretty amazing. We had 200 people and it was safe, clean, and incredibly successful. So we were really pleased to partner with everybody on that behalf. The only thing I'll just throw out there, because we are all a big team here, if you know of seniors, anybody who's 65 and older should receive the high dose of the flu shot, not the regular dose of the flu shot. There is a national and local shortage of that. It's kind of hard to imagine because we've all known about this coming for a very long time. But in May, when we ordered our flu vaccinations, we had a feeling that this would occur. And so we have a lot of seniors in our community, a lot of people that we know personally. The Farmington Valley VNA still has some high dose. We will run out before the end of this month. So if you know of anybody who has not been able to go to one of these clinics, if you know of somebody that you really want to make sure has the right dose, it is critical, more important than ever. we do still have it. Please contact us. I will give a shout out to all of the crew at the at Eno. We have 2 major flu clinics that we do for the town of Simsbury, for the seniors primarily, but anybody can come. So we already did one at Eno, and the goal, certainly because the town buildings are all primarily still closed to the public, we did successfully pull that off outside. It's getting harder and it's getting colder. We do have systems in place, and we have a lot of practice already because we have been to every town. We still have a number of more clinics to do between now and the second week in November. But we have been in every town where we've been able to practice significant more than what's recommended in terms of social distancing and crowd control, and not letting so many people in unless the others have left. So we've been able to be successful in different buildings. So hopefully we'll be able to get everybody vaccinated that needs to. But once again, if you know of somebody who's 65 or older and they haven't gotten their high dose, and CVS and Stop and Shop and Walmart and physicians' offices are out, I do still have it. So, but time is running out. Other than that, we're good.
Thank you, Nancy. Appreciate that. Any questions for Nancy and VNA? Appreciate all you guys do. Staying safe out there too. Sarah, last but certainly not least, how are you, my friend? How are the businesses?
So I'm going to be very brief, but I'd like to start out by reminding everyone to please shop Simsbury businesses. And the way this directly relates to public safety is the business communities, the ones that donate to police and ambulance and all the other important organizations and the schools. And if we don't have them, then that money goes away and that support goes away. We've had one building that has had 5 occupancies, 5 vacancies, people choosing not to renew their leases or closing and what have you. And we have 3 other businesses that have closed due to COVID, and that's just the start. So especially during the holiday season, especially as people are talking about donations and gift cards, please make sure that you're patronizing Simsbury businesses whenever you can. Just briefly, some very good news. As many of you know, I sit on several other committees besides this committee. And for the public that's listening, there are still very safe community events that are scheduled. I sit on Simsbury Celebrates, which is the Saturday after Thanksgiving. It is going to look different this year. We're going to have the individual performances, which used to happen in the downtown. They will be taped on SCTV, and it will be almost like a variety show that will show throughout the month of December. There will still be a fire truck parade, but it'll be a reverse fire truck parade. They're planning on having the fire trucks lining Iron Horse Boulevard, and people will be able to drive through and see them in their cars. And we are still planning a spectacular fireworks event. And then the final thing is I also sit on the 350th committee, on their marketing committee. We've done a lot of great things like the 2 outdoor socially distanced movie nights, which were very successful. And we're working with Culture Parks and Rec on doing a skating night, so skating days in the upcoming time. So, as we are all experiencing some, the wanting to get out, there are still community events that are happening. And because we're at 9:34, I'm going to end there today.
Sarah, thank you for that. And always a good reminder that we need to continue to support our businesses as we do the rest of the community.
Sean, can I have 2 minutes really quickly just to talk about something other than storm response?
Yes, please. I would love to hear that.
Quickly, just to piggyback on Kristen's comments about energy assistance. Besides storm restoration and those things, we do work on other things at Eversource. Mm-hmm. And we work with our social service providers on energy assistance and programs. So I just wanted to remind those that might be listening, if you need help with, special payment arrangements, there's a lot of items going on where people are struggling with bills during COVID and so forth. Or even not COVID related, sometimes those things happen. Please contact our customer service group at 1-800-286-2000. They can help you with questions, concerns, billing, special payment arrangements, programs that we offer. What I would also like to say is with energy assistance, where our energy efficiency group is also working with providers on no cost for a very limited time, no cost home energy assessments. So normally it would be $75, sometimes more, to get that assessment done. And they do a service that basically would cost around $1,000 for free. So they will do quite a bit of items. They give you a report at the end. They do some minor work for you while they're on site, but give you a very detailed report as to what you can do to make your home more energy efficient, and provide you opportunities and rebates if you do move forward with some of those measures. So to make your dollar go farther, make your home more comfortable, I would strongly encourage people to consider that. And in order to schedule that, you can go to either energizect.com or 877-947-3873, and you call and speak with a representative to help you schedule one of those assessments.
Thank you, Mark. That's an important reminder. That's very good, and especially a jump on to what Kristen said. All right. Next meeting is 11/19 at 8 a.m. I reserve the right to bring this group back together sooner. Heaven forbid. If there's a need, I hope there's not. But if COVID does continue to ramp up, I would expect to return to the cadence we had in the spring. I don't anticipate those being long meetings. But again, I thought the opportunity, you all do a great job of collaborating anyway, but just a good piece, an opportunity for us to collaborate here quickly on either a weekly or every other week basis. And I know the residents really appreciated the flow of information that a lot of folks do tune in and or get their updates from this group. So it's very comforting for folks to know that the leadership team is engaged, as you folks all are. And obviously I know that, but it's important that the residents all get an opportunity to see that and hear from you guys directly. So with that, once again, I appreciate all that everybody does. Please stay safe out there, and we are adjourned.